Okay, if everyone is okay, we can start, says Carla. I don't feel entirely comfortable at the moment with using a voice, also because I have a cold. So I will text and Daisy, that's me, will voice for me, for which I'm grateful. I'm very honoured to lead this very interesting panel talk with Charee, Henry and Biji. Thank you for coming. I hope I got those pronunciations right. Short self-introduction to break the ice. I'm Carla, Belgian, in Second Life since 2007 and in real life just a tiny bit longer. I have daughters and since recently also a grandson. My life experience with health was both first and second-hand experience. I survived a brain tumour in 2010, then a tumour in my leg in 2016. Both were removed surgically. The impact on health and peace was big, especially brain surgery. I needed to adapt and relearn who I was, as physically I did not show obvious signs. The second-hand experience is worse. Losing someone very close by cancer simply beat anything I had in my life. I had in my entire life, including a brain tumour. I joined Virtual Ability in 2009 and helped them out where I could for a while. After brain surgery, Gentle asked me to do a project concerning accessibility of university courses, which I did, even if I found it crazy after brain surgery. But it wasn't, it was part of recovery. Moving on to today, I'm teaching at a university, not regarding health, and combined with some own activities, which also includes activities in Second Life. I'd like to start with the first question to each of you. First, can you introduce yourself shortly to the public? Where do you live? What is your daily occupation? To Charee first.
Hello, everyone. It's 11 a.m. here, so I guess that's sort of good morning or good midday to you. My name is Charee Thompson. I am a professor and university scholar at the University of Illinois, so I'm in Champaign, Illinois. My daily occupation, I am a professor. I teach in the area of health communication. I also have an appointment in our medical school, and I also guide and lead the communication didactics for our local obstetrics and gynecology resident program, which I do as a way to ensure that communication training and practice is reflected in women's healthcare, which is something very important to me. Thank you for having me here. I've spoken at Virtual Abilities Mental Health Symposium once a few years ago, so I'm thankful for the invitation to come back.
That's quite some activity. I'd like to ask the same question to Biji. First, can you introduce yourself shortly to the public? Where do you live? What is your daily occupation?
Hey everyone, I hope you can hear me. Please let me know. I am a 75-year-old man in a 50 some odd year marriage. My health has been blessingly quite well. my interest in health has been lifelong on the edge. My father was a hospital administrator, and I was 4 years in the Marine Corps, and then quite a bit of my adult life has been in and around healthcare. I'm not a practitioner in any form, but I helped with administrative items and some global medicine and so forth, and veterans, which is probably where I'll spend the most of my a lot of time when we're there, because my impact statement is pretty much, you know, we have a war and the war is supposedly over, but just because it's over doesn't mean all the struggles have stopped. And that's kind of where one of the costs of war are. I'm not an advocate. I'm not a politician. I don't advocate for any political cause.
Okay, thank you for introducing yourself, Henry. Can you introduce yourself shortly to the public? Where do you live and what is your daily occupation?
Hello to all of you in our wonderful international audience. My name is Henry Germain-McCarthy, and I am honored and excited to be here, absorbing what this conference will teach me about how I can improve my efforts to promote health and peace. My identity as a pacifist began at age 20, when I first learned about nonviolent resistance to militarism and oppression from various peace organizations. I applied and was recognized by the federal government as a conscientious objector, CO, to performing compulsory military service for the U.S. For my alternative community service as a CO, I worked as an aide in a skilled nursing facility. This was a powerful immersion in the disability world, which stimulated me to pursue a career in rehabilitation psychology and disability studies. My professional work was focused on promoting the legacies of disability rights and self-help movements as the foundation for meaningfully improving public awareness, professional education, and social policy regarding holistic quality of life for the disability community. I live in the U.S., and I am also 75 years old.
Impressive, Henry, and for you all. I'm really honoured to have you here. It's surely interesting for everyone present. I'd like to ask the first question regarding health and peace. Did you experience health issues during your life, yourself or family, friends, colleagues? How did it affect a perspective on health and peace in your life? Charee?
Thanks for that question. For myself, my work is motivated by instances in which people, family, and doctors alike have said or done dismissive things, either to myself or people close to me. I've experienced them and witnessed them. I think my research tells me, and my life experience, and I'm sure perhaps this resonates with most, that although most people recognize that chronic illness and disability are features of life, for myself and those I've talked with, accepting and learning to live with them can be difficult and nonlinear in relationships. I was trained as a relational scholar, so I'm often interested in how people in their relationships navigate health and disability. And to be frank, a lot of this is my own reckoning with the disability in my own family and my own life and what it means. And also in helping and recognizing others that I've done work with, and attempting to amplify their voices and recognize their contributions. So, for example, I think one clear example is I had a graduate student a couple years ago who took one of our very sort of canonical um, theories or ideas about social support and just frankly asked me and said to me, Charee, I think as a neurodivergent person, that we make a lot of assumptions in our literature and our valorizing of these theories about what is good support or how people can best support. And that was really profound to me, because since then, um, I've really been rethinking how ableism is seeped into many of the things that we think are important about communication or how people should communicate. So those are just some of my reflections on this question. Thank you.
Thank you for that. I'd like to ask Biji the same question. Did you experience health issues during your life, yourself or family, friends, colleagues? How did it affect perspective on health and peace in your life?
Thank you. Yeah, as a young man, I joined the military, but I ended up having, I was selected for special assignment. So my assignment was easy, but some of the fellows I worked with were what they call retreads. They had a combat assignment, and then they were placed in the same training as I was. So they were older and had seen a lot of combat in Vietnam. And this is sort of an incident, but it changed me then, but it began to frame some of my later in life thinking and my interest in veterans issues. So imagine I'm 19 or 20, I'm single. At that time of our existence in the 60s and 70s, and in the military, we drank too much, we smoked, we did too many things. And there's 3 or 4 of us in a room, and we're quite a bit of alcohol consumed. And the older among us, which at that time was like 27, gave a mournful scream. And he let loose of his bodily functions. He urinated on himself. He started to cry. And what happened, it took him a while to tell us a story, but in his combat experience in one of the battles in Vietnam, where a lot of times the civilians and everyone else was involved, a young girl who they estimated to be 3 had a green can that looked like a grenade, and she ran up swiftly to him. And it was all logged, it was fast. He thought it was a grenade, and he killed her. And for the rest of his life, he didn't have a moment of peace. And even though narrowly that was the correct action, you could rationalize it. But I also know that he died early. He was just a really good guy who could never unleash the burden. And so that's why as I became learning that later in life, I became more active in veterans issues, because there's people carrying a lot of stuff, and it affects them, it affects their family, it affects their friends, and it's a difficult thing that at the time wouldn't be recognized. Had he admitted it, he'd have lost his career.
That surely sounds like a major, major trauma, doesn't it? And yes, this is me agreeing, Daisy. Thank you for sharing that, Biji. So, Henry, my question to you. Did you experience health issues during your life? Yourself or family, friends, colleagues? How did it affect perspective on health and peace in your life?
Henry says, personally, I did not experience health issues until my older years. I acknowledge that not having to directly manage the functional difference and social discriminations of a personal disability limits my credibility to speak about disability issues. Instead, I have learned about the personal experience of health challenges through close relationships with people who had a disability or chronic illness. I will describe two different sources of personal relationships I was privileged to have that informed my understanding and positive perspectives on living a full life despite challenges in health or other life areas. While working in a skilled nursing facility, I was intrigued by the variety of ways that the residents cope with their significant health challenges. I bonded with several of the residents, who became my first teachers about the ups and downs of the disability experience. Through those and many other relationships that I have cultivated with folks in the disability community, I learned about being caring and genuinely collaborative in my work and in rehabilitation, and how to be an advocate and an ally in activities led by the independent living and disability pride movements. My professional training and work was grounded in an ecologically systems approach. Thus, I emphasize giving at least as much attention to altering the multifaceted environment as we do to changing the physical or mental characteristics of the affected individuals in order to improve their functional capacity and well-being.
Thank you, Henry. I'd not really say your credibility to speak about disability issues is less when you had the luck of being healthy most of the time, but you did experience it via others.
Dr. Henry says, and I'm so grateful for those relationships.
I have an interesting question for all three, with totally different backgrounds, yet something that intrigues me a lot, having had some experience with both sides of health. The question is, do you see a distinction between physical and mental health, or are they, according to you, equal or intertwined? What is your perspective on both? I'd like to ask Charee first.
Thank you. To me, they're intertwined. My understanding is that the link between our minds and bodies is still not well understood, at least from perspectives that in orbits I tend to hang out in. And I even hesitate to talk about them in this way for fear of reinforcing some sort of dualism, the mind-body sort of split that has harmed so many people. In my work, a lot of that has to do with how physical pain gets written off as anxiety or depression. I do know that no matter the approach or the frame or the lens, whether it's biological or medical or phenomenological or personal or autobiographical, the list goes on. There's recognition that they're connected. And for me, I've been guilty of and continue to try to dismantle and reimagine my own quote unquote life of the mind orientation to my profession and my life more generally. It's a work in progress, but privileging the link between inner peace and health and embodiment is really at the forefront for me these days in my professional and personal life.
I can imagine, says Carla. Biji, what is your perspective on this?
Turn on your microphone, Biji.
Can you hear me now?
Yeah.
Thank you. I'm sorry. So in my more modern era, from the most modern conflict and where I chose to work with the veterans, it's my opinion that it's clear, and it's actually more than physical and mental, because it's societal. Because if you're working, just using a traditional model, man, woman, children, and typical, but not always, husband goes off in the military, but it could be either in the modern era. They have a severe disability. The husband, besides everything else, comes back, and this is from some discussions I've had with people who attempted suicide. And they left, they're robust, they're strong, they're the leader of their family. They get wounded, they're being treated over an extended period of time in a facility away from their family. This guy's enlisted, and so and by that I mean he's not making a lot of money. So, and his wife and daughter are cashiers at a Walmart in a distant state. He becomes distressed. He feels he's no longer the head of the family. He's no longer the breadwinner. He's become a drain on them. And that's not an uncommon situation. The family wants to help, and they do. It's extraordinary. In most cases, sometimes not. Sometimes the families can't stand it and they break. So you have this whole mental thing where he's willing to be so distraught, but you have this bigger framework where people look at you outside from differently. You lose your humanness in interactions. Examples: if we're out with a bunch of warriors that have explicitly seen disabilities, arms, limbs, maybe disfiguration, you can see a gap. If you're in a crowd, there's a gap that would form around us. And people weren't being mean, people didn't know what to do. So I believe there's a completely significant link between those three and maybe more. And once again, that's an opinion.
You lose your humanness in interactions is something that really stuck with me in your explanation, Biji.
Thank you.
Henry, from your perspective, do you see a distinction between physical and mental health, or are they, according to you, equal or intertwined? What is your perspective on both?
I believe almost everything we experience is interconnected and interdependent in various ways. Our bodies, governments, societies, and natural environments are all so intricately complicated that there have to be lots of intersections. We continue to discover new intersections through the technology of neuroscience, and we get reintroduced to others through the cycles of renewed appreciation of wisdom perspectives from the past. Mental processes have always seemed more mysterious and less accessible to our intervention compared to the functions of the palatable physical body. Actually, in various ways, our cognitions and emotions are ultimately what we can, with intentions and practice, most autonomously control, as long as damage to our brain cells or chemistry does not disrupt that autonomy. To sustain our sense of personhood and agency, we can choose how to react cognitively and emotionally, no matter how our bodies fail us, or whatever ways despots or authoritarian societies restrict our lifestyles. Certainly, it takes discipline to control how we focus our mind and what we feed it, but it is a power we possess. Let's consider these opposite examples. We know of one, some people in ideal situations with fully functional bodies and all sorts of resources who nonetheless feel miserable and choose to end their life. Two, other people who manage to become beloved examples of humanity despite being imprisoned and tortured for years. For example, Nelson Mandela of South Africa. Or despite having dysfunctional bodies that others describe as imprisoned by total paralysis. For example, Ed Roberts, a man who lived in an iron lung after his bout with polio and eventually became a dynamic leader in the independent living movement in the United States. When I worked in the skilled nursing faculty, I assisted another such person named Francis White. His anatomical deformities were so limiting that he was truly confined to bed, not for the convenience of caregivers, but because he couldn't breathe easily in an upright position. His physical world was the 3 foot by 7 foot bed where he lay, but his worldview was represented by a group of international pen pals that he corresponded with regularly. An ability to discuss history or current events from what he learned listening to the radio that sat next to his pillow, and a personality that was like sunshine, a daily gift, especially in an environment that many people find so depressing that they won't visit their close relatives living there.
Thank you, Henry. For me, the word power, empowered, in brackets, resonated in your explanation. I would like to ask Charee if she has any comments or questions for Biji or Henry.
Thank you. I don't at the moment.
Okay, Biji, do you have questions for our fellow panel members?
Let me try to, can you all hear me now? Okay, I think you can. So, Charee, the question I have is, because you alluded to some things at the beginning, it has been my belief, once again, it's an opinion, maybe less so now, but I think that women in the medical system are often treated in not in an overtly disrespectful sense, but in a less important sense. And from years ago in my family, I noticed it, and it has long-term implications in family member one that I know of. And I was just curious as to your opinion on that.
Thanks for that question. Yeah, I think I tend to study the interpersonal manifestations of that, whether in the doctor's office or with family. I mean, structurally, that's been an issue too. I mean, we know that women have been left out of medical research, and even when that was attempted to be rectified in the 90s and the early aughts by the NIH, for example, women were still not being recruited into studies that were supposed to be about female bodies. And then also women were excluded from studies without good reason or just because they were pregnant, so to speak, and seen as high risk, but there was really no good reason they couldn't be in the study. It's not like it was a risk to the fetus necessarily. So I think knowledge about women's bodies is lagging and continues to lag. And what that means, I think, and what I see in talking to women I've interviewed, even young women today, is that without those hermeneutical resources, those knowledge bases and whatnot, it's difficult to understand your own experiences and be able to talk about them and have other people recognize them if we just don't have that knowledge, I think a good example of these sort of resources I'm talking about is I tell my students about the term gaslighting, which I don't know about you folks, but it seems to be a lot in social media and just in popular culture. And I tell them, when I was your age in college or when I was younger, we didn't have that term to describe the experience of when someone makes you feel like you're crazy, or they challenge your what you know about yourself, or they tell you like, oh, you're not really having pain, you just must be anxious, which is something a lot of women will tell you they've been told. And so we talk about the power of language and having terminology to call something out when you're experiencing it. So I hope I've answered your question. I could talk so long about this topic because it's the core of what I do, but I will say it still persists. I think it happens in more mundane, sort of quotidian, everyday ways that aren't so obvious, like, you're crazy, you're not really experiencing that, right? But other things that we normalize, the way that we exclude women or disabled women, and so forth. So
It was helpful. Thank you.
thank you.
Oh, whoops. Sorry, I didn't put my microphone on. Carla said, first of all, yes, that is very clear to me. And now, Henry, do you have questions for Charee or Biji?
I appreciate their sharing, but no questions now.
Smiles. Well then, I have a question left for you all, which might help people present here. Charee, what would you advise all of us regarding this life experience with health? What do you consider as utterly important to learn about health and peace?
Oh, goodness. I'm going to speak from my narrow experience and my own sort of personal and professional reflection. So please keep that in mind. I've been reflecting on this a lot lately, and I think it really comes down to the core need, the core human need for personhood, safety, and social connection. I'm coping with turbulent times in the US by trying to understand people who are ideologically opposed, so I can contribute to some healing. I recently read an unattributed quote that said that every atrocity in history began with someone deciding who counts as human. And that's been rolling in my mind. And while my work often focuses on drawing attention to this through disenfranchisement and precarity as concepts, one way I've been dealing with this is to read work that helps me imagine otherwise. So, for example, I was recently introduced to the work of British sociologist Ken Plummer, who talks about this notion of critical humanism. And his book is described this way, so these are not my words. Quote, critical humanism critically reflects upon and reimagines humanism for the 21st century. What is now required is a fresh, wide-ranging imaginary of an open, worldly, plural, and caring, underscore caring, humanity. It needs to take a critical stance towards older, often divisive ideas of what it means to be human, while reconnecting to a wider understanding of the rich diversity of life in the pluriverse. We need instead to create a vital new political imaginary of being human in a connected planet. We simply cannot afford to be anti-human or post-human. Restoring our belief in humanity has never been more important for edging towards a better world for all, unquote.
Caring is most probably the essence of it all. Biji, what would you advise to all of us regarding this life experience with health? What do you consider as utterly important to learn about health and peace?
It is my belief that I've alluded to through here, but I'm going to be more direct. We've been in so many wars in my lifetime, and I'm not going to argue about whether they were justified or not, because it's not what it's about. But in making a decision about war, it's not a 3 or 4 or 5 year decision. It's probably more like 50 or 75 years based on the impacts. And so there are probably reasons to go to war. But I think in considering those reasons, it's more than body count and how much money you spend. It's about what am I really spending to achieve this objective. And maybe there's a case to be made that it is, but it's I think a more judicious way. I'm not a political leader. I'm not going to go back and try to Monday morning quarterback what's done in the past. And I do think going forward, I love what Charee is saying, and uh, how do we look and build bridges. I do some volunteer work globally, and my working theory is if you have friends in other countries, if your kids go out with their kids, if you have economic endeavors that are collaborative in nature, that it's a whole lot harder to have a war when you're mutually dependent. You have family members, you have friends, you have businesses. You're way more reticent to think about the idea of going to war and the price that you're going to pay. And I'm not a peace activist. I think I've come to be a realist in the real costs.
Nods. Thank you for that, Henry. What would you advise to all of us regarding this? Oh, what would you advise to all of us regarding this life experience with health? What do you consider as utterly important to learn about health and peace?
My first recommendation is to contemplate the words and examples of peacemakers and social change agents. This will inspire and educate you on ways you can contribute your skills and support to people and organizations that are doing good work for wellness and inclusiveness. You can do this by reading publications by or about them, or by networking through other media. After this self-education, try doing volunteer work or pro bono professional work with others already involved in promoting health or peace. Start by finding a need or gap in your community that is a barrier to people's maximizing their well-being, safety, or autonomy in their daily lives. My final suggestion is the easiest to do. Communicate messages and reminders that encourage you, your networks, and anyone on the streets to do their part to promote compassion, harmony, hope, inclusion, etc. It can be done with signs in your yard, on your door, or on your bumper, words or images on your clothing, jewelry, or email signature. For a few decades, I have chosen to wear a peace sign or compassionate message every day. My latest item in this collection is a colorful button that says, "Make America Kind." Being kind and encouraging to each other will strengthen our health and sense of peace. And if we have peace in our hearts and our hands, we can give peace to our communities and the world. That's my wish for all of us. Thank you for inviting me and listening, and a big hug of gratitude to the Virtualability community for producing this stimulating conference and for all the supportive and groundbreaking work that you do all year long.
These are three different answers, but in essence the same. Caring, kindness, compassion, helping. This is great. Thank you so much for your deeply motivated and strong answers for my questions. I'd love to hear if there are questions from the public. Sky.
Okay, so Mook's question is, this is for Biji and Henry. You work directly and continually with, you work directly and continually with people with severe trauma and PTSD. How do you and your staff protect yourselves from the same risks and also from despair? Are there safety protocols or guidelines that you follow, and do staff review each other for symptoms?
Okay, well, the part about being perfectly formed, I don't think was attributed to me, and I'll just let Dr. Henry do that. But what my experience with the suicide in general have been people who have lost the physicality led to some sort of mental distress, and plus the overt societal disdain and distancing. So I volunteered years ago with Wounded Warrior. I haven't been able to get out there lately, but they actually have programs that help bring you back. I've been in places where we've done yoga, as an example, to help restore a system of peace. We have met, on one occasion, we went to another country and met their own wounded veterans and some of their current military people, and that restored a sense of camaraderie. And so I think part of what I've seen on the positive side is building the camaraderie, understanding others that can be helped. There's been a great deal of advance in medicine in prosthetics. Not as much, I don't think, on the mental side, but I see mental really kicking in. And I also think it's been the societal acceptance of people who have the various injuries and visible incapacities is way more accepted than it has been in the past. And I think the mental aspects are way more accepted. I hear people openly talk about seeing a therapist and not sharing necessarily what it is, but the fact that they might seek some help is way more accepted than it was 20 years ago. So I think there's been advances. Is there enough? No. My own family, back a generation, had a real problem with suicide, and it just I think we've come a long way since then.
Okay, thank you, BJ. I think we were getting a bit ahead of ourselves here. Henry posted an answer too.
Yeah, Dr. Henry responds to one of the questions by saying, I think burnout is an issue that all helping professionals and direct caregivers should be aware of, seek help for, and accept feedback from colleagues and their consumers.
Okay, then there was Sky. So her comment is, Margaret Mead famously was asked what the first sign of civilization was, and her reply was that they found an ancient human bone that had been broken, then apparently healed, and pointed to that as an indicator because that showed caring for an individual. The question is, I'm curious if the lapses in inclusion of women in studies and access to care are more prevalent in particular disciplines of medicine and mental health care. General practice versus OB/GYN, psychiatry, psychology, specialties, military versus civilian sectors. Are female doctors better at helping women than male doctors? Has anyone observed any of this?
Goodness, I'll jump in. I put some of this in the chat and we were going back and forth. The last part of that question is, yes, there's lots of evidence showing that patients prefer women doctors, or I will call it like feminine ways of relating, the caring, the relational emphasis, etc. I also am cognizant that a women physician in my studies talk about how that takes an emotional toll on them having to perform caring and kindness all the time, and also it's a bit of a double standard that that male colleagues are not expected to perform that as well. So I think it's something that women both value about themselves as physicians, but also recognize is kind of an undue or can be a burdensome expectation. So I think it's a both and. It's complicated. That first part of that question about lapses in the inclusion of women and knowledge gaps in specialties, I think I would have to do more research on this, but my sense is that yes, there are knowledge gaps in some areas more than others, like pharmacology and neurology and cardiology. And you've probably heard of things about recognizing that women experience symptoms of heart conditions differently than men, or they present differently. I think what's interesting to me are the persistent disparities. So even within cardiology, there's research showing that women wait longer in emergency rooms for the same symptoms, such as heart attack symptoms, for 16 minutes longer than men. Or take, for example, the specialty of OB-GYN. Even within that specialty, there's been far more research and emphasis and money put towards reproductive health than, say, other non-reproductive conditions that affect women, such as endometriosis or pelvic pain, for example.
Dr. Germain-McCarthy says, I apologize that my short example of someone's committing suicide seemed crass or judgmental. I'm willing to chat directly later about the purpose of contrasting those dramatic examples, which were expressed from an observer's point of view, not the subjective experience of the person.
Other questions? I think there was one from Mook, wasn't there? That was quite a while ago now.
We already answered that one.
Money might have done. I got a bit lost. Right, okay.
Oh, Gentle has a question. Thank you for all your words of wisdom today. Question for Henry. Where do we get a pin like yours?
Lily, sure, type your question.
Lila says, how can women do better in demanding care? I had a doctor straight up say, nothing is wrong with you, with your brain, when I had 6 aneurysms. Yikes, we found later. Or could I have done better? I just had to find a new doctor.
Might be a question for Charee.
Yeah, I'm first sorry that you've had that experience. Yeah, it does sound like gaslighting, or a physician who, like others have said, is not willing to dig into it further, or what physicians will do is sort of just punt it to someone else, so it's not their quote unquote problem anymore. Yeah, I'm going to share in the link, and if you email me, it's just my first name at Illinois. I'm happy to share the PDF with you. But a student led a project that I think, if you read it differently, is basically a study about how to say things to doctors in ways that are enfranchising, or we call it scaling. So one of the examples I'll give is if they say, what women will do is if they say like, oh, everything looks normal, there's nothing wrong with you, they'll contest the normal by scaling. We call it scaling down. Well, they'll point to very specific, concrete, sort of measurable things. So instead of saying, there's nothing wrong with you, you don't have that, you'll say, well, I've been having this really sharp pain for 6 days and it lasts for 20 minutes. And it's much harder for someone to come back at you when you're being that very specific and concrete. So that's just one thing that came out of the study that I shared there, and I'm happy to share the text with anyone fully. But there are sort of things that you can say and linguistic sort of power moves you can make. But unfortunately, sometimes you just need to leave that doctor. And I recognize that that is time and money and resources and delayed care. But no one should subject themselves to a physician that's harmful.
I'd like to answer that question myself too. If it weren't for my friends at Virtual Ability, I would have stopped fighting against stupid, in inverted commas, doctors at the end of 2009. And that would have been the end, as my brain tumour was real, and I measured growing logarithmically. And just a minute, I'll read this again. I'm getting in a mess. If it weren't for my friends at Virtual Ability, I would have stopped fighting against stupid, in inverted commas, doctors at the end of 2009, and that would have been the end, as my brain tumour was real, and I measured growing logarithmically. Cell splits. I forced to get direct support, and got it. Okay.
And Henry's saying that he got his kind pin at a church convention. He's going to research where they got it, and he's going to let me know, and then I will let folks know here in Second Life.
Carla says, thank you. There is time for one more question. Anyone?
And Emmy just posted where you can get Henry's peace sign pendant in Second Life. And yes, Luke, you're correct. I was asking about Henry's Keep America Kind pin in RL. So let's thank the panel. They did a wonderful job.
That was a truly amazing talk, and we love to hear 3 entirely different perspectives, which basically synchronise so well at the end. It is clear sharing those experiences help us understand more what health and peace is about.